Awake craniotomy. It's interesting to know a very useful tool what we utilize for safety when we are operating on brain tumors. Brain is very complex, as you know, and there are multiple areas of the brain which are concerned with particular function of the body. When we are operating very close to these areas, we should make sure that we are not transgressing into these important areas so that that function is not affected. The best way how to know it is when the patient is awake and if he is able to give us a feedback what is happening to him. It looks a little difficult to comprehend, but it is something most of the patients will wantingly do when they understand the need that will give them a margin of safety when we are operating. We will take the patient beforehand to the operating room, show them what is going to happen inside, and then when we are opening up the skull, we will give local anesthesia so that they will not perceive any pain. It's curious to know that once we get into the layers of the brain as such is totally insensitive to pain. When we handle the brain, pain is not perceived. That's an advantage, so that when we are operating, we can wake up the patient and we'll ask them to say something, speak something, move their hands. And then when we are closer to those important areas, we will notice, the patient himself notices and says that he is having trouble in moving his hands, for example, or moving his legs, or difficulty in counting numbers, or telling a story. So that's when we know we have reached the limits and we shouldn't go further in that direction. Very interesting, but very useful tool. Most of it is how the coordination between the anesthetist, the person who is doing surgery, the nursing team, and the technical aspect of it, who will be assessing the patient constantly, and of course a very cooperative patient.